So question is regarding deforming forces once you're doing an infrapatellar nailing. See, it's not the infrapatellar nailing which deforms something, right? It's the positioning of the limb that deforms. Now, what happens is when you're doing an infrapatellar nailing, no matter how we do it, whether we do it freehand, whether we'll do it with the limb hanging, or whether we do it with the limb on the fracture table, we have to keep the knee flexed. The moment you have kept the knee flexed, what is happening is because of the pull of the patellar tendon, the proximal fragment is going into extension, right? So that's the constant deforming force throughout this. When you extend the limb, as what we do when we do an suprapatellar nailing, automatically these forces are taken care of because now the patellar tendon is no more pulling the proximal fragment, right? The moment you flex, it is going. Now, I've discussed and described each of these nicely with pictures in my talk on suprapatellar versus infrapatellar nail. For those of you who have not seen me, you may go into the app and have a look at it, including the CM pics, intra pics, and X-ray pictures we have discussed. So that is the common problem that happens. The other problem that can happen is the proximal fragment goes into valgus. Okay. Again, depends on the fracture plane, but mostly it can go into valgus. So you would require a slightly more lateral entry and a slightly higher entry. Now, all this is much easier with the suprapatellar approach. So the positioning is what matters. It is not the technique of the implantation per se. Okay. To overcome these, there is actually a third method now, which is being used by some surgeons, and again, being liked by many surgeons. It's the so-called extra-articular approach. Okay, the benefits of suprapatellar approach is not the approach per se. It is not the implant per se. The benefit is because of the positioning of the limb, that the limb is kept straight, and there are very minimal deforming forces. Hence, reduction is easier. There will not be malangulation during the surgery, and we can do all the things, right? But the disadvantage of suprapatellar is that no matter what, we have to go in the patellofemoral joint, right? Of course, we are going in the knee joint also, but the direct damage can be to the undersurface of patella or the trochlea. In some patients, this may lead to bad outcomes. So, what is the best way to overcome is that to have a certain surgical approach in which the damage to the patella and the trochlea may not happen, plus the limb is kept straight throughout the course, and that is what is called an extra-articular approach. Okay, so in which the limb is kept straight, you're taking a parapatellar incision and using the jig to, guide pins to take an entry throughout the course. The limb is kept straight. Okay, so that also is the third method now, which is giving us the benefits of both the worlds. That the limb also is straight, and we may not damage the patellofemoral joint also. Okay.